Assalamualaikum and salam sejahtera. Thank you for taking us or give opportunity to us in presenting prevention of central line dislodgement by Gleneagle Jerudompa Medical Centre, or known as GJPMC, Brunei Darussalam. This project conducted by Intensive Care Unit, or known as ICU, under Nursing Department. So our team member is the leader is Siti Haja binti Muhammad, Senior Staff Nurse 1. And then member is myself, Siti Raja'ah binti Said Sultan, Senior Staff Nurse Zuraidah binti Haji Hassan, and then Staff Nurse Siti Noanika. The facilitator for this project is Ms. Chandra Devi Durai Raju, Director of Nursing, and Ms. NGY Hong Wai Yo is our Assistant Director of Nursing. So the sponsor is Gleneagle Jurudong Park Medical Centre. So the aims of statement, this project is to monitor incident of accidental removal of device in critical patients to identify their cause, when they occur, and then if they are repositioned. And then also to integrate the knowledge of current nursing skill with a competent professional role in central line management and care. So for initial state, the central line complication in year 2020 recorded a total of 3 dislodgement from operation theatre, OT, intensive care unit from ICU, and then one is from cardiovascular laboratory, or known as CVL. The objective of this study in central line management is to formulate a standard nursing skill and accomplish the objective guideline for nurses and also a doctor to be accountable for their action, their patient, and their peers. Although the incident is only 3 cases, but the impact on patient are extremely high, especially when IV iron stroke is in progress. So we have in GJ, we have one incident. The patient went to hypotensive and nearly to be resuscitated because of the central line dislodgement. So if you can see the picture here, the central line before the project takeover, the way they are dressing the central line. So you cannot see the puncture site and then the suture also. It's not safe to practice like this. So we want to close the gap to prevent the central line dislodgement. So we come with gap analysis, why this thing happened. So we can divide to 4. One is procedure, and then second is the staff, third is the patient itself, and then the hospital management. So for the procedure is from the root and obstacle, wrong dressing technique, and then suture method. So for the staff is less experienced, and then high workload, and then unskillful. And then for the patient part, patient behavior, sometimes patient become aggressive. This is sometimes caused by medication effect. And then skin condition, especially patient that easily sweating or profusely sweating. So the dressing is easily detached. Then it's not intact to the skin. So the securement is lost. And then sometimes patient confused also, not aware about the line. It's happened one case that the patient thought it's the gown string, so he pulled he thought it's a gown string, so he pulled it, and then it's actually is a central line. So we need to inform the patient also. Management, there is no standardization of procedure, no proper guideline. So if you can see the picture, this is the before of the project takeover. So the dressing is they just covered by Tegaderm, and then we cannot see the puncture site, and then it's a bit loose. So after the project takeover, the dressing, standard dressing that we use is a CHG or chloroacidin dressing. And then the securement also, we emphasize on how to secure the dressing with the dressing. So, and then the suturing also, we involve with the doctor, and then we inform them that the technique of the suturing, the method of suturing that we need to use. So they change to the shoelace technique. So this improvement can show a good result. So the approach, we do a retrospective observational cohort study in central line management in the critical care unit based on the daily census. The study was conducted on smaller scale. Data review was collected from July 2020 to October 2021. The total number for this year, 1,116 on central line inserted at GJPMC, and the total of dislodgement happened in year 2020. Okay, monitor and audit is done closely with the implementing of Pepsi prevention bundle throughout the Gleneagle GPMC. We collaborate also with the cardiac surgeon and all the doctor in changing and complying with the guideline. Complying with the guideline in preventing central line dislodgement. So outcome is to reduce the central line complication, example of bleeding, infection, improve standard of nursing skill in dressing, securement and care, maintain the good standard of practice among all the nurses in GJPMC, ultimately improve the quality of care and reduce rate of incident dislodgement. This can see by the result that we don't have this year for central line dislodgement. Okay, I include also prevention of epilepsy. We have 0 event. Okay, so you can see the graph, how many line was inserted, and then we don't have dislodgement. Okay, epilepsy also, we don't have epilepsy in GJ. So how to sustain this project? We uploaded and encouraged the doctor and the staff to use central line management guideline, especially in suturing, dressing, and handling, especially while transferring the patient. Secure the central line as a per GJ PMC guideline or the protocol. Monitor the compliance of the staff, start from the operation theatre or CVL, cardiovascular lab. Continuously monitoring and auditing randomly on the suturing method, central line dressing, and then we also do awareness on central line care. Okay, this one have to be consistently doing the awareness. Okay, report all the incident of central line dislodgement under hospital occurrence report for root cause analysis. So we want to tackle the problem. Extra care during transfer, and then we need to remove the central line if not in use to prevent dislodgement. Assess the staff for central line care management and care competency for allocated unit in every 2 years. So you can see the dressing, how after the project, how the dressing look like. So we use CHG dressing, and then we label, and then the shoelace suturing. Okay, that's all from me. Thank you. Assalamualaikum.